Assalamualaikum warahmatullahi wabarakatuh. Let me introduce myself. My name is Nurul Nahrir Musa. So, in this video, we will discuss and do what and how it measures blood pressures. What is the blood pressure test? A blood pressure test is an examination with a special instrument called a sphygmomanometer, which measures the pressures in the arteries when the heart beats. This test is usually done as part of a routine doctor's examination to detect the presence of high blood pressure, hypertension.
Blood pressure is one of the vital things that can describe the function of person's body. Vital signs consisting of blood pressure, body temperature, heart rate, and breathing that are above or below normal numbers indicate a disturbance in patient health condition. Thank you.
Why is a blood pressure test needed? Blood pressure tests are usually done as part of routine health checks in patients with certain medical conditions such as elevated blood pressure, hypertension, or heart problems. Blood pressure will be checked specifically and more frequently.
Important blood pressure is examined because most patients with high and low blood pressure do not experience any symptom. Hypertension can increase the risk of serious illness such as a heart attack and stroke, while blood pressure is low and causes dizziness and fatigue in some patients. In patients at risk of hypertension, namely having excess body weight or systolic blood pressure 130 to 139 mmHg, or diastolic blood pressure 85 to 89 mmHg. Blood pressure test needs to be done once a year. For aged patients 18 to 39 years with tension 130 to 85 mmHg and have no risk factors for high blood pressure. Blood pressure test needs to be done every 3 to 5 years in patients who have been diagnosed with elevated blood pressure, hypertension, or hypotension. Blood pressure tests will be performed more regularly.
What are the preparations for undergoing a blood pressure test? Before doing a blood pressure test, some of the preparations that need to be done by the patient include: rest at least 5 to 10 minutes before the test, avoiding coffee consumption, smoking, and strenuous activity such as exercise, at least 30 minutes before the test.
Assalamualaikum warahmatullahi wabarakatuh. According to the American Heart Association, blood pressure measurements are classified as flow sama dengan normal sama dengan below 120 sampai 80 mmHg in increase between 120 per 129 mmHg for systolic pressure and below 80 mmHg for diastolic pressure. Hypertension level 1 sama dengan 130 per 80 mmHg up to 139 per 89 mmHg. Hypertension level 2 sama dengan 140 sampai 90 mmHg or more. What to do if the blood pressure test results are abnormal? If the blood pressure test results in increase, the doctor will usually recommend lifestyle change therapy to lower blood pressure. Terima kasih.
The steps for modifying this lifestyle can be reducing salt consumption, implement healthy and balanced diet, get regular exercise, reducing alcohol consumption, lose excess weight, quit smoking for patients who have been with hypertension, blood pressure lowering drugs from a doctor may be needed.
What are the side effects of a blood pressure test? In general, there are no serious reactions from a blood pressure test. The patient might feel a little uncomfortable when the tension cuff presses on the arm, but this only lasts for a few seconds. In some patients, painless response may appear on the arm where the blood pressure test was performed. The spots are more common in patients taking antiplatelet blood thinners.